entered medicine as a tribute in part to my mom. My mom, unfortunately, was diagnosed with breast cancer at a very young age, and while she was a 17-year survivor, she did succumb in 1996 to the disease. And my mom was a nurse. She was a nurse for over 30 years, and she always wanted her son to become a doctor. And I initially didn't really have much interest in medicine, but as I saw her go through the process and help take care of her, a passion was born. A passion was born. I was first introduced to the concept of the clinic in 1997 through the Abington Episcopal Church Outreach Committee. And while I did not serve on that committee, I was asked to serve on the original board of directors to help oversee the clinic in its formation. So that was my first contact, and through the board work and through volunteering. This opportunity, when it became available, was a great opportunity to give back to the community that I've come to love and enjoy living in. And it provided opportunity to serve those folks who unfortunately may be going through some tough times right now, because the concept of the clinic was to provide care to those people who were sort of between insurances, for the working poor who couldn't afford insurances in this unfortunately down economy. Nobody's getting rich. The dedication of our volunteers is unsurpassed. We've gone from like 25, 50 volunteers when we first opened the clinic to over 250 now. When the clinic first opened, we were seeing patients 2 nights a week, Tuesday and Thursday evenings. And as the numbers started to grow, we realized that we just couldn't meet the need of the community with just those 2 days. We now see patients 5 days a week, Monday through Friday, in addition to our Tuesday and Thursday evening, where most of our volunteer physicians rotate through because they're working during the day. The legacy that I foresee is the fact that we have gone from a building that has been on loan to us now for almost 14 years from the Riverside Health System. We now have the opportunity at year 14 to be looking at purchasing a freestanding structure where we will own the clinic itself. The Gloucester Matthews Free Clinic will own the building and be able to provide all of our services under one roof, the clinic itself, as well as the dental clinic, which we've expanded on over the last couple of years, as well as our administrative offices, all in one structure, all in one building. To have that patient come in and say that, you know, you've turned my life around, I'm able to get back to work, my diabetes is under control, my hemoglobin A1C is doing great, my blood pressure is doing great, I'm able to get back into the workforce and be a productive member of society. Even we've had a lot of patients who had the opportunity to actually get insurance and not have to use the clinic services. So that's been fantastic to see that happen.